Interviews are the final hurdle in the med school admissions process, but for many applicants, they're the most intimidating part. In particular, multiple mini interviews, commonly known as MMIs, tend to cause a lot of anxiety. They can involve several interviewers at once, and they might feel more like an evaluation than a conversation, since they require you to problem solve and role play in real time. But even though they require a special kind of preparation, MMIs don't have to be scary. In fact, they were actually designed to give you a better chance at demonstrating the full range of your skills in a way that traditional interviews might not always convey. In this video, we'll demystify MMI so you know exactly what to expect and how to use the unique MMI format to your advantage. We'll discuss what your interviewers will be looking for, and then we'll share our strategies for approaching 3 sample scenarios so you can learn how to put those strategies into action. Before we begin, don't forget to like this video and subscribe to our channel so you can be the first to see our new resources with all the latest updates and guidance on med school admissions. First off, it's important to establish what makes the MMI distinct from a traditional med school interview. MMIs involve more than one interviewer, whereas with traditional interviews, adcoms might have to base their conclusion about whether you're a good fit for their school on the subjective opinion of just 1 or 2 interviewers. MMI interviews allow adcoms to draw that conclusion from your interactions with a variety of interviewers in a variety of contexts. MMIs use rubrics for evaluation, making them more standardized than a traditional interview. This is further insulation against subjectivity. With a clear rubric, there's less room for interviewer bias. MMIs allow you to demonstrate more of what you have to offer. Rather than just telling an interviewer about your qualifications and experiences, you get to demonstrate your teamwork, communication, critical thinking, and problem-solving skills. It's also important to familiarize yourself with the format of the interview, as it's structured very differently from a traditional interview. MMI interviews are typically composed of about 6 to 10 mini interviews, which are typically located at different stations. At each station, you'll get 2 minutes to reflect on a prompt and brainstorm your potential responses to it. Then you'll spend about 8 minutes answering questions or completing a task, which might involve role-playing as a doctor. At each station, you'll receive a performance rating between 1 and 10, with 10 being the highest possible rating. You may also be invited to participate in a virtual MMI, which many schools have elected to use in the years following the COVID-19 pandemic. Only time will tell whether schools decide to stick to this virtual format or eventually phase it out. But for the most part, you should prepare for virtual MMIs the same way you prepare for in-person. You'll also want to make sure you have a quiet, empty environment to conduct the interview in, to keep your camera at eye level, and to avoid reading your responses from a script. The prompts and questions you might encounter during an MMI can vary widely from one school to the next, and they usually revolve around the school's institutional values and mission. It's helpful to remember that although you're technically the one being interviewed, this is also your chance to gain important information about a school. If you end up with multiple admissions offers, you might use the information you learned during the interview to help inform your decision of where to commit to attending. In general, though, the questions at every school's MMI will fall into one of the following 3 categories: ethical scenarios, with or without acting; character development, with or without acting; and teamwork, with or without acting. MMIs are a bit like the Casper exam in that instead of just telling the admissions committee about your academic accomplishments or prior clinical experiences, they give you a chance to directly show them how you communicate, empathize, problem solve, and work with the team while keeping your patient's safety and well-being your top priority. You won't need to draw on medical knowledge to diagnose someone, but you will likely be asked to show interviewers how you would interact with a patient or colleagues under specific, complex circumstances. The goal here isn't so much about giving the right answer as it is about assuring adcoms that you took the right steps to arrive at your own personal conclusion. After all, there's rarely just one right way to handle real-life scenarios. Interviewers are much more interested in seeing how you process, critically think about, and respond to those scenarios. Throughout your interviews, you'll be rated based on how well you demonstrated qualities such as respect for patient autonomy, beneficence, meaning working in the best interest of your patients, non-maleficence, meaning do no harm, respect for human rights, bedside manner, and thoughtfulness and reflectiveness. Throughout your responses, it's extremely important that you clearly articulate your thought process and reasoning in order to showcase these qualities. On that note, don't be afraid to ask your interviewers follow-up or clarifying questions. It can be a great way to demonstrate your communication and problem-solving skills while also allowing you to give a more thorough and informed response. And if you need to ask questions during a role-playing scenario, just remember to address the interviewer or other actor as the patient or colleague they're pretending to be. The best way to prepare for the variety of different scenarios you might encounter during an MMI is to practice responding to them just as you would during a real interview. And you can find hundreds of the most common traditional and MMI questions, including sample responses and analyses for each, at our med school interview question bank, so you won't be caught off guard by anything you encounter on interview day. As you practice with the questions in the question bank, it's also very important that you practice the skill of clearly articulating your responses under the pressure of a time limit. We recommend you set a timer and a recording device, then have a friend or family member ask you questions or role play with you. After your time is up, replay the recording to review your response. At first, you may find that you ran out of time to tie up your thoughts neatly, or that you blanked and ran out of things to say. It happens, but the best way to hone this unique skill is to keep practicing. To get a better sense of how to prepare for your MMIs, let's take a look at a few prompts, starting with the first category, ethical scenarios. Ethical scenario prompts tend to be the most stressful for interviewees because they're designed to test your decision-making skills in situations that require complex ethical considerations. During those 2 minutes of brainstorming and preparation time at each station before going in to meet with the interviewers, you'll want to make the best possible use of your limited time. After reading the prompt for an ethical scenario, there are 2 questions you should keep in mind. First, what's the primary problem? Oftentimes, a scenario will contain a lot of extraneous detail. Start by filtering through all of the information to determine what's important and what's not. Then narrow your frame to focus only on the details related to the primary problem, so you can develop a clear and effective response. The second question you want to ask yourself is, what is the question testing? In other words, what do interviewers want to learn from my response? Here's an example of an ethical scenario you could encounter during an MMI. You are an emergency room physician. A 31-year-old female patient comes in complaining of severe back pain, but after a physical evaluation and several tests, there's no evidence of an injury or other cause of pain. You look at patient history and notice that this patient has visited the ER several times in the past 6 months, each time requesting medication with no success. You politely inform the patient that you will not prescribe the painkillers. She then says that if you cannot provide her with the prescription, she knows someone who can provide her with Vicodin. Walk into the room and continue the conversation. Following the steps we outlined a moment ago, let's first identify what the problem is. The patient is showing signs of a drug dependence or addiction, and she is threatening to endanger herself by using illegal drugs if you do not prescribe the requested medication. Next, identify what the interviewers are seeking in this response. It's clear that they want you to prioritize the patient's well-being. They also want you to maintain your integrity as a physician and only prescribe medication when necessary. Once you complete these 2 steps, it'll be time to enter the station and meet the interviewers. Keeping in mind the primary problem of the scenario and what interviewers are seeking from your response, your goal should be to obtain the key information you need to make your decision. Asking questions will help you make the right choice while also showing interviewers that you have weighed your decision carefully. It's also your chance to show interviewers how you would compassionately communicate and empathize with a real patient in such a complicated and high-stakes situation as this one. Some key questions you might ask the patient in this particular scenario include, what have you done to manage the pain between this visit and your last visit? And what risks associated with using pain medication are you aware of? After you've asked your questions and listened empathically to the patient's responses, you'll need to make a decision. The most thoughtful and responsible decisions tend to fall in a gray area between 2 black and white extremes. In this scenario, the 2 extremes are giving in to the patient's demands and prescribing the requested medication, or refusing to prescribe medication and sending her home without any explanation. Some other decisions that fall between those 2 extremes are prescribing a small amount of the medication to mitigate the risk of an overdose, or refusing to prescribe the medication and directing the patient to the appropriate resources for substance dependence or abuse issues. In this particular case, you have done a thorough workup to rule out any illness or injury, and the patient has clearly demonstrated that they fully intend to continue using the medication with or without your prescription. Therefore, the final decision is the best one. When refusing to prescribe the medication, you should still demonstrate compassion for the patient and explain your reasoning. Then, discuss resources that are available to the patient so she can address possible substance abuse issues. Now let's consider how to approach an example prompt from the second category, character development prompts. These prompts are the easiest to prepare for because you've likely thought about them when completing other areas of your application, like your personal statement or secondary essays. Here you can expect traditional questions that require some self-reflection, like, what is your greatest weakness? Or, tell me about a time when you dealt with an unmotivated coworker. Interviewers ask these questions in order to understand how you've responded to personal challenges or difficult conflicts. The best way to approach them is to describe the situation clearly and what the problem was, explain how you responded and why, and explain how the conflict sparked personal growth for you. Here's an example of a character development prompt you might encounter during an MMI. Tell me about a time when you had to share negative feedback with a teammate. During your 2 minutes of preparation, ask yourself what information you think interviewers are hoping to gather from your response. For example, what kind of skills or qualities would a doctor need in order to deliver negative feedback effectively while still maintaining professionalism and respect? Then ask yourself, when have you utilized those skills or qualities while delivering negative feedback on a team? What did you learn about yourself? What are you proud of, and what, if anything, might you do differently if you could? How did the other person respond, and how did you both move forward from there? Now let's take a look at an example of an effective response. When I worked at a pizza restaurant in college, one of my coworkers kept leaving work several minutes before her shift was officially over. As a result, my coworkers and I had to spend extra time completing her closing tasks. One day I approached her and said that the team had been working extra hours to close the restaurant. I asked her if everything was okay and if there was anything I could do to help her. I made sure to first find out if there was a situation outside of work that she needed support with. I also made it a point to discuss the problem at hand. It was difficult because I really enjoyed working with her, but sharing the feedback in a delicate way, we were able to resolve the problem while also preserving our relationship. This response demonstrates that the interviewee is a compassionate person with sound interpersonal skills. Instead of criticizing the weak teammate or calling her out in front of the other employees, she shows strong leadership and genuine respect by approaching her one-on-one and asking if she needs support. These are all crucial skills in the medical field, and interviewers will be reassured that the applicant is prepared to deal with the complex interpersonal dynamics of life as a med student and future physician. Finally, let's review the approach for a prompt from the third and final prompt category, teamwork. Doctors are constantly working in teams with other physicians, physician assistants, nurses, and other staff. In order to work effectively and efficiently, each member of the team needs to be skilled in communication, listening, motivation, and decision-making. For these prompts, MMI teamwork stations will require you to complete a task as part of a group. Your team might consist of other applicants, actors, or the interviewer themselves. Whichever teamwork scenario you're presented with, your objective should be to demonstrate that you're a team player by volunteering your own ideas, validating others' ideas, and communicating constantly throughout the task to make sure everyone is on the same page. Now let's go over an example of a teamwork scenario that you could be asked to roleplay. Two teammates are sitting at a desk with blocks. One teammate is assigned the role of the builder, and the other is assigned the role of the instructor. The builder teammate is blindfolded and is the only person allowed to touch the blocks. The instructor is given a photo of a structure and must give directions to the builder to recreate the design. If you are assigned the instructor role, keep in mind that your teammate cannot see the structure at all. Put yourself in their shoes. Anticipate what information you would need to know to complete the task at hand. You might be tempted to say something like, move the block to the left. However, this direction is not specific enough. Instead, you'll want to give instructions like, okay, move the block slowly to the left until I tell you to stop. Nice job. Speaking clearly and providing positive reinforcement whenever possible can demonstrate your solid leadership and communication skills to your interviewers. If you're assigned the builder role, listen to instructions carefully and do exactly as you're told. When you're uncertain, be sure to clearly and respectfully articulate your questions. And even if your instructor isn't doing a great job, try not to appear frazzled or annoyed. Take things one step at a time, do the best you can with the information you have, and show your interviewers that you can perform calmly under pressure and think on your feet. After the task is complete, your interviewer might ask some follow-up questions. A key guideline to follow while answering these questions is make sure you never criticize or blame your partner for making an error or failing to finish the task. Focus on your own performance instead. Reflect on how you could have handled the situation differently or on what you've learned from the exercise about how to be a more supportive and productive member of a team. MMIs are your chance to show AdComs that you're the full package. They've already been impressed by your stats, experiences, and essays. Interviews are just the final piece of the puzzle. And although they do require a little more preparation than a traditional interview, once you get familiar with the format of the three main prompt categories, you can prepare yourself to tackle nearly any scenario. As you practice for your MMIs, resist the temptation to do and say everything perfectly. Remember, interviewers understand that this process is stressful, so they aren't expecting perfection. You'll continue to develop the skills they're assessing for as you transition into the role of a clinician, but medical schools just want to ensure that you have a strong foundation to build upon. So approach your interview with confidence and know that if you've made it this far in the process, you have what it takes to do well in your interviews and seal the deal on your acceptance to medical school. And as you continue to prepare for your MMIs, be sure to check out our med school interview question bank, where you can browse hundreds of the most common traditional and MMI questions, including sample responses and analyses for each. Best of luck.